Good evening. My name is Jeremey Pearce. I'll be doing a presentation or a speech on organ donation. Here with me I have Julie, Jason, Kelly, and Jeff Harrington. How do you think you would feel if you really, really wanted something? What if it was something you couldn't live without? How do you think you would handle that situation? I'm here today to share with you my views on organ donation and hope that you will take it to heart and give someone the ultimate gift after you have left this life, the gift of life. What I'm going to tell you is not a myth, but a fact of life. Did you know that 17 people will die today? They will not die because they were in a car wreck, involved in a shooting, or because it was simply their time to go. 17 people will die because they didn't get an organ transplant in time. Money is not the issue here. There are potential donors who pass away every day that can meet the needs of the patients that's on the waiting list. The problem is the potential donors die without leaving instructions that they wish to be organ donors. Each donor could enhance the lives of up to 50 people. Everyone should sign up to be an organ donor because it's the greatest gift you can give anyone. It's the gift of life. According to the United Network of Organ Sharing, as of April 18th, 2010, there are 710,000 people on the waiting list for organ transplant. The actual number of organs needed is even greater because some people on the waiting list are waiting for multiple organs. 17 people die a day waiting for the transplants. 6,205 people a year die from waiting for a transplant. What if this was your loved one? What would you do to lower these numbers? On this graph here, I have a waiting list first donor versus total deaths in the United States as of January. The waiting list, again, consists of 107,028 people. The amount that received a transplant or is waiting or did receive a transplant is 2,198. The people that's waiting as far as still alive waiting to donate is 1,138. The number of deaths in January was 202,320. Every 13 minutes, another name is added to the national waiting list. 103 people every 24 hours is added. 37,595 every year. The United Network for Organ Sharing coordinates the donors and the recipients. They have very adequate system that ensures everything runs smoothly as effortlessly as possible. Patients who are on the waiting list, life-sustaining transplant must rely on the generosity of others and misfortune of the generous people. Someone must die in order for others to live. Dying is part of life, and no one likes to talk about it. The reason many people don't like to talk about organ donation is because it involves death. But by discussing organ donation and deciding to donate, you give another person a chance of life. Some people may ask, what is organ donation? Organ donation is simply the removal of tissue from a human body or a person who has recently died, or from a living donor for the purpose of transplanting. There are many types of organs that can be donated, such as in a deceased, right here on a deceased donor can donate lung, heart, kidneys, pancreas, liver, intestinal organs. A living donor, on the other hand, can donate things as well. They can donate kidney, a portion of the liver, lungs, intestines, or the pancreas. As like everything else on organ donation has controversy issue regarding the organs. Faith in the medical system is important to the success of organ donation. Brazil has switched to an outpatient system that ultimately had withdrew because it's the patients who already distrusted the country's medical system. Adequate funding, strong politics will see the transplant outcome improve. The existence of specialized training, care, and the facilities also increase the donation rates. Legal definition of death, such as Spain uses, also increases the pool of eligibilities by donors, allowing the physicians to declare a patient dead earlier than the stage. Allowing or forbidding payment from organs affects the ability of the organ. Generally, their organs cannot be bought or sold. The safety is high. The quality and safety are high, but simply the supply equate to the demand is low. Where organs can be purchased, the supply increases somewhat, but safety declines. As families and living donors have the incentive to unfavorable information, healthy humans have 2 kidneys, so why not give 2 kidneys or 1 kidney? The most common transplant are the close relatives, but people were giving kidneys to other friends. The rarest type of donation is the undirected donation, whereas a donor gives a kidney to a stranger. Less than 100 of such kidney donors have been performed in recent years. Searching as the Good Samaritan donors via the internet has also came a long way with saving lives with organs. However, internet advertising for organs is highly controversial practice, as some scholars believe it undermines the traditional list based on that system. An overwhelming majority of cases, organ donation is not possible for reasons of the recipient's condition. Even in Spain, where it's the highest organ donation rate in the world, there are only 35.1 actual donors per million. There are hundreds of patients on the waiting list. This rate compares to 24.8 per million in Australia, where the families are rarely asked to donate organs, and 22.2 per million in France, which, like Spain, has a consistent system. Now, here are some frequent asked questions. The frequent asked question, donate disfigures, will the donation disfigure the body? No, donation does not disfigure the body. It will change, or the change look at the casket. Well, don't. Another one. What age do you have to be for organ donation? You can be at any age as long as it consists of the parents' consent. If you're under the age of 18. Now we'll go to the, if you're 18 or above, you're allowed to donate whenever you wish. Right here's the register. How do you register with your state? How can you help? For our local area, you can reach, I believe it's Jennifer Jinks, and her phone number is listed there as well as her address. The Register of the Tri-Cities is Mountain Region Donor Services, which is located in Johnson City, Tennessee, and services 8 counties northeastern Tennessee and 8 counties southwestern Virginia. It provides organ and tissue recovery services to 25 area hospitals that strives to increase the awareness of critical need to organs and tissue donors. How do you go about signing up to be an organ donor? This is very easy. You can designate your decision on your driving license. You can do this when you obtain a new driving license or renew a driving license. You can sign a donor card that you've seen on the screen, and you can carry this with you. The donation decision of the and then once you get your driving license update, you can do it there. The most important thing is to talk with your family about your decision. Let them know that this is your duty after you die, that you would like to save other lives. I hope you take in consideration what I've said today and become an organ donor. Thank you.